Welcome back to the Dr. Rich channel. Today we have a special guest, Lucero Tarin. Lucero is here to talk with us today about endometriosis and infertility and how what you don't know might keep you from getting pregnant. Now, there are many risk factors for infertility, including factors that affect the sperm, the quality of the eggs, the ability to ovulate, the tubes. Today, we're going to talk about endometriosis, which makes up about 15% of all infertility. Now, that being said, women who have endometriosis, of those women, 20 to 50% are infertile. And for women who present for infertility, 20 to 50% have endometriosis. So as you saw in the thumbnail, Amelia, bouncing baby 8-month-old,
yes,
has joined us. And tell us about your journey with infertility, endometriosis, and how we're able to bring this wonderful bundle of joy into the world.
Yes. So thank you, Dr. Rich, for having me and making that journey a little easier for me. But my husband and I decided we wanted to have a little baby, and we started to try, and 1 month became two became 6, and then a year, and then 2 years. We saw fertility specialists. We did a few rounds of IUIs. Did all kinds of blood work and tests.
And how long had all that gone on?
The total time was about 3 years.
And what symptoms did you have?
Very heavy periods and painful. It was very, very painful to the point where I had to medicate. If I didn't medicate, I couldn't function.
Yeah, and this is very common for endometriosis. And I think many people have heard of endometriosis. 15% of women have, 10 to 15% have endometriosis. So it's pretty common. The thing is, many women don't know they have it. They just have painful periods, and they also happen to, not be able to get pregnant. And a lot of people don't connect the dots. Now, it's important to understand that pregnancy doesn't occur automatically in any circumstance. In fact, the chances of getting pregnant in any given cycle, when both the male and female partner have total normal reproductive function, is only about 20% per cycle. The cumulative pregnancy rate over 6 months is about 70%. IUI is intrauterine insemination. So the patient would come in and the syringe would be passed through a speculum into the cervix, into the uterus, and the sperm would be directly injected into the uterus, thereby increases the chance of pregnancy. But that didn't work for you.
No, it didn't. And it was, I think, more emotionally draining, just because it was a lot, and it's a lot to go through mentally. Physically, I think it was okay.
Yeah.
So once we moved back to El Paso, I immediately went back to Dr. Rich's office, and I explained what was going on and said, I think I have endometriosis. So that's where he listened to me and said, what, let's find this out.
The symptoms and the history and the infertility, it just all made sense. And I think it was pretty quickly after that we scheduled and did a laparoscopy, which is, at least in my office, a robotic procedure with small little incisions, inflammatory proteins that affect the tube. It affects the sperm. It affects tubal transport. It affects the uterine lining. It affects your hormones. And it just throws off all of these very delicate processes that are required for pregnancy. So in your case, there was a lot of endometriosis. It graded out to stage 3, even involving the appendix. And we were able to take all the disease out in an outpatient same-day surgery. What was your experience?
It was pain-free.
Wow.
To the point where I thought it was weird. I was like, is this how it's supposed to be?
Yeah.
So it was immediate. As soon as I had my first cycle afterwards, it was immediate and all the pain was gone. I didn't have heavy bleeding. So those symptoms that I was experiencing that were very obvious to me were gone. I didn't expect to be pregnant so soon after surgery.
Like in the recovery room, or how soon?
Mine is a little quick. So it was about 3 months later.
Yeah.
that we conceived our little baby girl, and it was quick. And a little bit of a personal note, I took a pregnancy test to tell myself, you're not pregnant, stop getting excited, because I had missed my cycle. And so I was a little bit past due, and I just took it to, bring my emotions back down.
Yeah.
And then when I found out I was pregnant, my emotions really went up. And I was super excited, and I was nervous and in disbelief, really.
Yeah. Because it's been such a long journey, right?
Yeah, it was such a long journey. And it was kind of those ones like I should have listened to myself a little bit sooner, but I think it all worked perfectly in the end.
What advice would you have for women that are suffering with pain, infertility?
Do your own research, listen to yourself, listen to your body, and go with Dr. Rich, because that's what I did. And it worked perfectly for me. If you are struggling with infertility, there is a possibility that, you could have a baby, because I thought I was at the end of it, and I wasn't. I did get my little baby.
Thank you everybody for watching. Know somebody who has trouble with fertility. Make sure you share this video and impregnate that subscribe button.